Hello, my name is Chinwe EBM, and I'm here to present CLAMSY, which is central line associated blood stream infection. And the main objective that I have for this project is to decrease central line infection in patients that are admitted in ICU, especially the place that I'm working, Eastside Medical Center in Snellville, Georgia. And like I said, that's the problem that, and for us to know that clumsy is something, is a, infection that have been occurring and affecting thousands of patients. And decreasing that infection is my main priority. And when we decrease those infections, we have increase in patient outcome, decrease hospital cost, and we have increase in patient turnover, patient satisfaction, they will increase, and also our profit margin will increase. Like I said, it affects billions of dollars in added cost every year. And the thing is that clumsy is well prevented. It can be prevented. I want to look at the people that are affected with clumsy. Patients in ICU, family members, doctors and nurses, all of us that are healthcare workers, we're affected one way or the other if one patient has clumsy in the hospital. And how can this be solved differently? And when this is applied, the project that I'm trying to project, if it's applied, we have increase in patient turnover. We also have decreased complication. We have increase in, improvement of the quality of care that we give in ICU. Also, we have decrease in costs because we're open to make business. The stakeholders that I have are the, for this project to be implemented, I have the ICU director, charge nurse in ICU, the nursing educator, where I have the nurse practitioner, the nurses, the charge nurses, and also infection control and pharmacists. I want to look at what education requirements am I going to give them. The educational requirement I'm going to give them is, where I'm going to set up with the use of clumsy bundles. There will be education, there will be in-services, there will be, and this education in-services will be, the person that was going to champion it is going to be infectious disease nurse. And her work is to coordinate this work and make sure that this project is taken care of and executed. And also the nurse practitioner, her job is to insert the central lines in ICU using the protocol that is, that is allowed. The charge nurse, her job is to make sure that these central lines are being dressed every 7 days as they ought to be dressed, and also they are removed if they are not needed, because if we remove them promptly, we decrease the chance of getting infected. Also, the clinician, the ICU nursing clinician in ICU, her job is to amend, to add into the protocol and policies of clumsy, and also the protocols that are needed to supervise all the educational materials, everything that is needed. And how will the ICU director help? Her work is to back. Her work is assist. Her work is to make sure that this project goes through the institutional review panel that we have, and also to provide the funds. She solicits for the funds that are needed for this to be taken care of. And also, I'm going to look at what theoretical foundation do I use for this, my concept, for this work. I use Practice Banner's theory, which is novice to expert. And in this theory, it have to advance evidence-based practice. It have to, implement the proposed study that that you have in a clinical setting where individuals receive care and better outcome for patients as well. Also, with this model, the framework of nursing is applicable to this project that I have. Also, we using this framework, resolving clumsy will be a thing that will come to pass in ICU, inside ICU. Also, using this framework, we find the gaps that lead to infection and find solutions to them. When I did this work, I collaborated with some people. I collaborated with nurse leader, I collaborated with nursing educator, and also the nurse practitioner. And what the nurse, educator, what she told me, her recommendation was to communicate with the staff about CLAMSI, to provide training that are needed in an ICU, educate the nurses about CLAMSI, and teach them about how infections can be prevented. Knowledge is power. When the nurses know what to do about CLAMSI, then they can implement it. Also, the second person that I talked to was the educator that I spoke, the clinician. And what she told me, she said, education is the key. She recommends education of the nurses and the student nurses, every new staff that comes. They must have CLAMSI education. Also, to prevent hands-on training. When you have checkups, you teach them how to do central line. They have checkups, and then they'll be ready to do it. Also, the next one is the nurse practitioner that I talked to. Everybody talked about education. It says to the nurses to participate in education of CLAMSI. Also to gather opinions about people. What did the nurses think about how to solve this? What did they say? Even when we implement this, what are the feedbacks that we need to do? What are their ideas? What are their concerns? And also, what did I do? What did I learn through this doing activity? The importance of collaboration, solving problems, how you can use collaboration to deal and to develop and implement solutions, also to analyze the problems, also to create, to resolve problems, also to communicate with one another, the staff, the team members, every one of us will communicate, amicably to find a solution to this problem. And my recommendation was that the nurses would download the app that, on CLAMSI, and the risk factors about CLAMSI, measures to prevent CLAMSI infections, complications associated with CLAMSI, and also steps that we're going to use to decrease CLAMSI. Okay, where is my solution innovative? Why is it innovative? Because it puts the knowledge of CLAMSI and the prevention in the hands, fingertips of the nurses. Also, they'll have that cheat sheet that they can always go to get information about CLAMSI. Also, it will help the nurses to better prepare themselves about preventing CLAMSI, as well as to reducing infection. And also to, this app that you're going to, application will be very, very applicable to the smartphones that we have. Thank you so much. These are all my references that I use. And thank you for listening to me. And